Hi, I'm Jonah Comstock, editor-in-chief at pharmaphorum. I am joined virtually today by Joe Spinelli, SVP Product and Strategy at Access DX Laboratory. We were hoping to connect on the ground at JP Morgan. We were both out there in San Francisco, but we just couldn't make the meeting work. So we're doing this one after the fact. But it's good to finally connect with you, Joe.
Likewise, Jonah. Thanks for the time today.
So tell me a little bit about yourself, about Access DX. What do you guys do, and what brought you out to San Francisco last week?
Yeah, absolutely happy to. So just by a little bit of background, I've been in and around the precision medicine software solutions world for the better part of a decade. And prior to that, spent a fair bit of time actually investing and working with high growth, high tech startup companies. And so it's been really interesting to kind of see the evolution of the use of precision diagnostics and the way that they are implemented, evolve over the last few years, particularly. And really what our ethos is with our companies, which includes Access DX Laboratory, which is a center of excellence for diagnostics, to be precise, which is a lab agnostic diagnostic solutions company, and then Singulab, which is a laboratory services business. All three of those entities are under an umbrella called Aranscia. And what our ultimate thesis of what we're working on is to really put a dent in the universe by delivering what we call human-centric diagnostic solutions. So for us, everything that we do under each of our different businesses is really focused on solving the tactical gaps that have historically existed in either providing access to diagnostics or the utilization of those diagnostics effectively within the clinical workflow. So in short, it's really taking a lot of these very intuitive types of promises that precision medicine has bandied about for decades and making it actionable at scale for the clinical partners that we serve.
Interesting. Yeah, it's almost like there's sort of two parts to precision medicine, right? There's precision treatments and the diagnostics that let you figure out who gets them and who gets what. I heard at some cocktail parties at in San Francisco that their diagnostics is a hard area sometimes to sell the pharma companies on investing in because the line to their bottom line isn't as clear. They'd rather sell to more people than to fewer people. Has that been your experience?
Well, there's probably a lot to unpack on that one. And the reality is, if you really think about whether or not there is a direct incentive or disincentive for pharma to want to see precision medicine more broadly brought out, I think when you look at where you want to be on the right side of history is if there are low cost, high quality diagnostic tools that can help increase the efficacy or identify where the benefit of a therapy or a molecule or a medication is going to be more effective in improving the treatment outcome and be cost effective in that nature, that theoretically should be something that is a net positive for the entire ecosystem. And so I would look at a number of therapies and molecules that are in development right now that have biomarker programs attached to them. And what you're really doing there is you're actually helping to improve the efficacy of those medications by ensuring that there is metabolic compatibility with the individuals that are being prescribed them. Theoretically, that should make it easier for certain companies to make a case as to why they should be reimbursed what they are for these therapeutic treatments, because they're helping to actually dial in where the therapeutic efficacy is, and also helping to rule out individuals where, for all intents and purposes, they may be getting something that's no better than a placebo. So our view has always been this information and the dissemination of it and the utilization of it at the clinical layer is really going to go a long way to helping to just provide a lot more fidelity to the overall benefits of these diagnostics. And at the same time, looking at preventing adverse events and looking at issues with pharmacy cascade, there's a whole nother set of benefits economically that are outside of the pharma ecosystem, right? So we'll take an example in cardiac or behavioral health or pain management, you can pick which. But if you're being prescribed a therapy that's going to be ineffective for you or has the risk of additional cascading side effects, you're now no longer just affecting the medication cost or the direct line treatment cost of that individual. And I think what's historically happened is those are two separate buckets of cost and value and reimbursement. And it's been very hard to really tie a through line between all of those different entities. And so I think just anecdotally, that's probably where there's a lot more friction because it's just so ambiguous as to like who gets to own that, who gets to control it, who gets to say mission accomplished, and then what does it matter or how does it impact what we describe as value for those certain therapies on the front end. So there's just a lot of systemic issues that we're not going to see be solved, I think, in a very short period of time. However, we as an organization, and for what we've been working on for the better part of a decade, are not waiting around to see all these things come through. There are very strong clinical and therapeutic guidelines, many times on label for certain medications. Our goal is to surface that information or to help facilitate surfacing that information to clinical partners so that they can use it as part of their overall decisioning process, right? It's not to put a complete mandate in front of somebody because that would never be effective. You have to take a lot of things into account, not just precision medicine insights, but to at least democratize the availability of that information. Like this person is being prescribed something for a cardiovascular treatment and their body is metabolically not going to metabolize it effectively. What do we want to do about that? Isn't that information that would be helpful in getting that person to the right therapeutic treatment? And so I think we are seeing that shift in the clinical layer of saying, yes, this is a no-brainer to include. And if we can take down the barriers to accessing that information, making it scalable, that's really blended well with third leg of the stool, which has been the precipitous decline in cost to get these diagnostics run compared to where they were 10 plus years ago. So we're really at this really interesting nexus for it. And my expectation, and quite frankly, with some of the discussions that we've been aware of, is that we're going to see, I think, a lot more harmonious work between different entities to get the right treatment and the right treatment pathway to the right individuals at the right dose and at the right time.
Certainly the payers have a vested interest in this as well as the providers. But who do you work with? I mean, do you work with everybody? Who are the stakeholders that you're reaching out to and saying, here, we do this now?
Yeah, well, that's a great question to ask. Each of our businesses serves a little bit of a different end market and use case. We'll talk about our software business, to be precise, specifically. To be precise's customers are generally health systems, national agencies, both domestically and internationally, as well as research organizations, large oncology organizations. And what they've often found is that they, as an organization, continue to move up what we call the precision medicine enlightenment curve. And sometimes it starts with, we don't even have an understanding of what's being ordered, why it's being ordered. There's no effective way to do it. There's a lot of stuff on paper. We're not surfacing insights. Help us at least make sense of what should be happening or what is going on in our ecosystem. And that's typically where we would first start being engaged with a lot of groups. But then it works all the way through helping to administer and oversee turnkey programs like pharmacogenomics, where organizations want to put a routinized process in place to build rule sets and identify where there's potential benefit, and to tie therapeutic through lines to driving improvement in care. And so a lot of that engagement happens really with the actual providers and clinicians themselves, right? When we move to some of the things that we do with Singulab, but also on the software side, we spend a fair bit of time in the long-term care world. And it's been a place that we've spent a fair bit of time as an organization for a while. And there, the problem sets are a little bit different, right? I mean, generally speaking, what you'll find is individuals that are in the long-term care ecosystem are on 10 or more medications. And you see a lot of staff challenges with just being able to service them. I'm sure, as you've heard or read, nationally, there just continues to be this huge labor shortage, which really diminishes the quality of care that individuals have. So by creating services and software offerings for those organizations, we can really help them in the aggregate from a population-based approach, identify where they can drive improvement, help them remediate and mitigate potential issues, and really put a dent in the overall efficiency of delivering better care. And there, it's kind of not directly intuitive, but indirectly intuitive in the fact that if we can help manage residents by eliminating pharmacy cascade and eliminating fall risks and other issues that are occurring because the medications are not optimized, that's a very easy thing to identify. And that's just one of many use cases that we engage with them on the diagnostics front. We do a lot of work in antibiotic stewardship. We do work in disease management, infection control. And all of these things are really designed to help put a dent in issues that exacerbate, really impact care quality, and go a long way to improving the clinician's ability to drive benefit for the patients they serve and to improve outcomes wherever possible.
So at a show like JP Morgan, what are you up to there? Are you looking for new customers, partners? Are you just trying to take the pulse and see what people are talking about, get the word out about the work that you do? What was the week like for you?
Yeah, well, aside for loving to spend some time in rainy San Francisco for a week, just because that's a fun place to be, the reality is for an organization like us, who continues to grow in customers, grow in engagement, grow in the breadth of depth of services, an event like JP Morgan allows us to do a couple of things. One of which is to stay incredibly engaged with partners that we work with, both from a clinical side as well as a technical side. We have a large number of interoperability initiatives with our software and services layers, and to help continue to strengthen and expand those relationships with our ecosystem is incredibly helpful. So again, being a good steward and helping to really design and discuss some of the programs we're working on. One of the things that's I am charged with under the Aranscia umbrella is corporate development. So what that includes is that our continued growth activities through mergers and acquisitions go across my desk. So that kind of show is also important for me to understand and identify and engage with assets that we continue to look at that we would bring into our portfolio. It's not our first rodeo in bringing new businesses into our business. My company, which was originally called MedTech 21, was acquired by Aranscia's predecessor business, Access DX Holdings, in 2019. And then in 2021, the entity acquired, to be precise, from Allscripts. So we continue to grow through acquisition, and we have a number of assets that are identified right now, and have our pedal down on looking for synergistic opportunities to do that. Fortunately, I don't have any news to break to you today, but as we continue to navigate this year, there's a lot of things from a ecosystem standpoint that are really synergistic with us, and we're really excited about not only growing both organically but inorganically when it's opportunistic for us.
Totally, that makes sense. I mean, diagnostics is a big tent that encompasses a lot of stuff, and I'm sure even with all of the different operations you guys have going, there's other omics and kinds of data and things that you have your eye on, right?
Well, you're right, and a lot of those worlds are incredibly fascinating. And for us, it's all about as much as we want to be everywhere all at once, it's not practical. And so for us, we really use that lens of human-centric diagnostic solutions as kind of a North Star when we look at our multi-year strategy, but also opportunities for us to partner with, right? So when you get into the world of multi-omics, there's so many phenomenal things that are happening right now, and even other areas of preventative diagnostics, looking at early cardiovascular diagnostic detection, and what types of tools are available now to help guide individuals and not lose folks who may be at low risk but not super high risk, and what can we do from an automated and diagnostics perspective to help those places. And so again, all of it for us becomes intuitive when we can help tie a through line to how do we help get that information into the hands of a clinical professional so that they can use it to both proactively identify and mitigate risks, but then also proactively identify ways to optimize and improve treatments for the patients they serve. So as much as we would love to be completely at the bleeding edge of where these technologies are going, we're much more focused on creating that delivery interconnect ecosystem and making them work practically from a workflow standpoint for the folks that we serve.
So I'll end with the question I'm asking everybody in my JP Morgan interviews, which I'm counting this as one of. What are the top pharma R&D trends that you are looking at for 2023? You can name one, you can name a couple. What do you see being kind of the story of 2023 in R&D?
Yeah. So I'll be honest. We don't live within the pharma R&D world per se. So I'm going to give you a little bit of a skewed world view, which is what we see based on our engagement with that community, which is typically thinking about workflow solutions, right? And so for us, it's really twofold, right? One of which is Generally speaking, pharma programs increasingly do not live in a silo, meaning that it is not go talk to your doctor about this therapy, right? It's more about understanding underlying disease conditions, looking through risk analysis, and then helping to effectively manage and improve insights for how these things can be delivered effectively. And so for us, that last mile concept of, how therapies can actually be effectively used and utilized is something that's incredibly important and, continues to be a big opportunity for both proactive identification of where a therapy could be beneficial, but then also to see it through to understanding all the other extenuating circumstances. So how do we layer in as many other conditions and insights and information about these individuals so that if they do successfully pass or fail a treatment regimen, we understand how to better optimize candidates in the future or how to better optimize, other extenuating factors for them, right? So it's about completing kind of the more holistic assessment of that. And to your earlier point, the ecosystem has historically not been set up for that, right? So we're seeing this kind of slow march towards broader adoption. And I think the other piece of it, particularly when we look at things like, oncology research, I think not to get too cute, but, there's always been this concept of like data everywhere. And I think now it's data everywhere and, not enough to drink. And then now what, right? And so data for data's sake is kind of a panacea that seems to have been generally addressed at this point. There are folks that are still trying to tie through lines and build new tokens and build new ecosystems, but for me, and there's still a number of R&D folks that are looking for kind of that last pocket of folks that they've never seen before. But the reality is, I think we're increasingly moving towards how do we stop looking at data for data's sake, but really turn data into information, and really our view is focused on doing that at the clinical level, right? There is so much in an EMR that is still left in notes fields and unstructured data and diagnostic results that can't be utilized effectively. And there's still a lot of jockeying going on for who gets to own the walled garden of that. We just continue to be unapologetic about democratizing that for folks that we work with. So when we work with large oncology centers, we want to help their clinicians get ready for tumor board faster by helping them to better navigate, tens of thousands of different diagnostic data points that they have, right? So it's really all about effectively helping to assist in the workflow to really create that next step function in development and improvement of care. And so that's really, again, what we're looking at. And I think there's going to be a lot more to come that you'll hear about in creating these kind of end-to-end programmatic approaches to therapies, regimens, and standards of care. It's just historically been done in these silos because we still haven't had the infrastructure catch up. And we're getting closer. And it really does feel like the next 24 to 36 months is going to be really interesting to finally, solve some of these last mile clinical challenges.
Well, something to look forward to. Thanks so much for joining me, Joe. Really interesting to hear this from your perspective. It's, I think, a unique perspective to the different folks I've talked to. So I'm glad we were able to catch up.
Likewise, Jonah. Thanks so much. And always happy to chat with you.